Well, heart disease is the leading cause of death for both men and women. And believe it or not, right now, nearly 45% of women are living with some form of cardiovascular disease.
With February being American Heart Month, we are asking what women can do to help protect their heart. Joining us around the table to talk more about this, we have Dr. Lisa Gleason, cardiologist with Sharp Memorial Hospital, and we want to thank you for being here.
Well, thank you for having me.
Let's start with the obvious. Let's talk a little bit about heart disease and what exactly causes it.
So heart disease encompasses a number of things. It can be acute MI, coronary artery disease, atherosclerotic disease. It can be stroke. It can be heart failure. The three of those make up the bulk of what causes the mortality in heart disease, but there's also a lot of arrhythmias that can cause some morbidity.
How do you lower your risk of developing heart disease?
So healthy lifestyle goes a long way to assist in that. That's maintaining a good weight, eating a healthy diet, largely plant-based. Mediterranean diets are optimal. Exercising on a regular basis, keeping your cholesterol and your blood pressure under good control.
So what risk factors are more common, let's say, in women than men? Because I'm interested to hear a little more about this, especially because they do say for women, there tends to be more women who are impacted by cardiovascular disease.
So women tend to have a later onset than men, and they have similar risk factors, including hypertension, hyperlipidemia, diabetes. However, they also have risk factors that they're not always aware of. So if you had gestational diabetes, preterm delivery, you had preeclampsia, you have microcalcifications of the arteries in the breast on the mammograms. All of those are additional risk factors that women have that men don't. And a lot of women say, oh, my diabetes was just gestational. I don't have diabetes now, but that gestational diabetes still puts them at risk for long-term cardiovascular disease.
I think what you're saying, doctor, there are a lot of symptoms very different between men and women.
There are. So while you may still have chest pain, shortness of breath, exercise intolerance, sometimes it's more vague. It's this anxious feeling, it's fatigue, and then you have to tease through a wide differential of other things in addition to cardiovascular disease to understand what's causing those symptoms.
Okay, so on that note, so when should we start seeking care? Because it sounds like there are a lot of different symptoms.
So if you're maintaining an active lifestyle and suddenly your activity tolerance drops down, that should probably be investigated. If you haven't been that active, give yourself a period to recondition to see if your exertional symptoms are related. If ever you have heavy, crushing chest pain, shortness of breath that's extreme, that's always an emergency room visit.
Okay. Is testing much different between men and women for heart disease?
Women have more microvascular disease, and so some of the tests that we use, like a CT scan or a coronary angiography, it doesn't demonstrate that as well, and so it's a little more difficult to test for the microvascular disease in women, although we use most of the same tests. And women are underrepresented in studies, and so we don't know as well as we do for men what is optimal.
What does treatment look like?
So treatment looks very similar between men and women. Statin therapy if your lipids are high and you're unable to optimize that with a healthy diet. Using beta blockers, ACE inhibitors, angiotensin receptor blockers, they're still mainstay of therapy. Aspirin if you've got known atherosclerotic plaquing, those are still our mainstays of therapy.
Can you quickly tell us about this free blood pressure screening at Sharp that's coming up?
So one of the big risk factors for long-term cardiovascular health is undiagnosed hypertension. And so there's a free screening at Sharp Grossmont and at Sharp Memorial on Friday. So come get your blood pressure checked. Why not know if you've got one of these risk factors and know you should optimize your healthy lifestyle.
Yeah. For heart health. And here's the deal. We'll have more information on our website about these times and locations at fox5sandiego.com. Click the Scene On tab and we'll make sure that you've got all the information there. Dr. Lisa Gleason, we want to thank you for being here tonight.
Well, thank you so much. This was fun.
Yeah, good.